Severe acute respiratory syndrome coronavirus 2, which causes COVID-19, has been declared pandemic recently. Through intensive research and clinical trials, scientists have come to approve the use of plasma therapy for preventing the clinical infections and reduce the severity in individuals with recent exposure to coronavirus. So what is this plasma therapy? The convalescent plasma is the plasma collected from individuals who have recovered from COVID-19 and have developed antibodies against this virus. Well, plasma therapy has been used for centuries in the past in cases of hepatitis, mumps, polio, rabies, Middle East respiratory syndromes. But the plasma therapy depends on concentration of immunoglobulins containing high antibodies. In such emergent pandemics where there is no enough time or resources to prepare immunoglobulins, plasma therapy has been used, which, unlike passive antibody therapy, offers long-term and durable therapeutic options. How does convalescent plasma therapy works? Let's see that. So, this was an unfortunate person who got COVID-19 and luckily through intensive care, he recovered. This person will have the antibodies in his plasma against coronavirus. Now, when the plasma from his body is transfused to another individual who has been recently exposed to this pathogen, the antibodies in the plasma will bind to coronavirus and nullify its infectivity. Another mechanism is through the activation of complement system and antibody-dependent cellular cytotoxicity. So, is this the first time convalescent plasma therapy is being used? Well, the answer is no. It was earlier used for severe acute respiratory syndrome 1 in 2003 and Middle East respiratory syndrome in 2012. And now China has been using it to treat the patient with the disease of COVID-19. A recovered individual decides to donate his plasma, he will have to meet the following criteria. He should have history of COVID-19 as confirmed by approved molecular testing. At least 14 days should have passed after recovery from the symptoms, that is fever, cough, and shortness of breath. And negative follow-up molecular test should be present, after which pre-donation screening is done and antibody testing is done. Now you must be thinking, what are the drawbacks of this therapy? Well, like most other things, the convalescent plasma therapy has its risks too, such as anti-systemic acute respiratory syndrome coronavirus 2 may lead to transfusion-transmitted systemic acute respiratory syndrome coronavirus 2. Another risk is antibody-dependent enhancement, or ADE, that is, after transfusion of anti-SARS coronavirus 2 plasma, in which the antibody which developed during a prior infection will cause increased clinical severity of infection when the individual is infected with different viral serotypes, such as in dengue virus. But both these risks are just theoretical. So, to conclude, plasma therapy is a safe and effective treatment for which substantial proof of benefits are present.